Dr. Styles. I'm filming my video for the scenario number one. So I read through the scenario. I have a couple different thoughts on it, and I'll just read down the list. If I look away from the camera, it's because I'm looking at the list of the questions to address. So, first question, what should you do first? First thing I would say is that I really appreciate that she had the confidence in me and she had the trust in me to be able to come to me with these issues, and tell her that I have her best interest at heart and that I want nothing for the best for her. And tell her, just make sure that she understands. Sorry, Patches is gonna. I just got home from Kansas City, so she's gonna be all of my business because I wasn't home. And tell her that um, everything that I do is going to have her best interest at heart. And then the next thing I would do after that is, since I'm a male, and this is dealing with the sexual reproductive organs of a female, I would ask this athlete if she wants me to get another female athletic trainer, if she would be more comfortable if there was a female athletic trainer there. And to ask if she wants me to even stay on the case. That I want her to be as comfortable as possible. I don't want to make her pregnant. Now we're not worried about that. I don't want to make her uncomfortable, as this is a very uncomfortable situation for her to be in for many different reasons. What questions would you like answered? The first one I would like answered is, when she throws up, is she making herself throw up, or is it just randomly her throwing up? I want to make sure that it's not some kind of bulimia kind of thing or something like that. I would also want to ask her how often her and her boyfriend are sexually active. That can be a key factor. I would want to ask her different things about how school is going, how things with her family is going, where if she how things with her boyfriend is going, just how everything is going outside of class, outside of everything that she's told me. I don't want to get a very minuscule idea of what's going on with her. I want to get a whole broad idea of what's going on with her. So for this situation, I would probably want to bring her into like my office or some kind of private setting that we would be alone and we know that we would not be interrupted. What issues should you consider? Think diagnosis, legal, ethical, moral. One that pops in my head right away is that she's 17. I know that she's in college and she's away from home, but I would have to look at the paperwork filed and see if, because I know it depends on the state, but if you're 17, sometimes you have to report it to the parents, and or maybe the parents signed a paper that we don't have to report things to them or something like that. So I would definitely want to look at that. Ethical, I would want to think about, again, and I talked about it a little bit, but I would want to talk about having a same-sex athletic trainer in there if that would make her more comfortable. And that goes into the moral a little bit too. And then for diagnosis, that kind of brings me into the fourth question of what conditions should you consider and why. I would definitely consider an eating disorder because of the loss of weight, the throwing up, and all that kind of stuff. I would want to consider I would want to have her take a pregnancy test, and that goes into five. But I would consider her being pregnant. I mean, missing a period for 2 months is serious. That's something you should definitely be considered, especially when her and her boyfriend are sexually active. I would maybe consider depression. I would want to ask her more about like her sleep schedule, how her general mood has been, and all that kind of stuff. But I would more consider anxiety. The anxiety of being a college athlete, especially for a 17-year-old, where we don't know where she's from, so she might be far from home. This might be her first time far from home, and then her boyfriend is 20. Let me look through. He's 22. I knew he was older, much older than her, so that's stressful. Class can be stressful, especially with her wanting to be a pediatrician someday. I mean, that's insane. That's so much work. So I'd be worried about stress levels and stuff like that with her. So anxiety is definitely something I'd want to consider with her. Sexual assault, statutory rape is another thing that I could have talked about in question three. What issue should I consider? Because I mean, I guess I don't know the rules for New Mexico, but I know in Illinois that would technically be considered statutory rape because she's not 18, so she can't make her own decisions yet since her boyfriend is 22. But I know the rules are different per state, so before I go to this school, before I would work at this school in Missouri, I would look at what what the rules are for that kind of stuff. As it's college, people are exploring and kind of doing their own thing and that all kind of stuff. So, what diagnosis do you think is most likely and why? I don't think she's pregnant. I think she is working out a ton. I think she's going through a little bit of the female athlete triad, female athlete triad. I can't remember exactly what it's called, but it's something that for female athletes that causes them to miss periods. I know that a lot of I had a lot of I played on the tennis team at Cornell at my undergrad, and I know that during season, especially during preseason, some of my female athlete friends would go through the same thing at the tennis team, and they would talk to us about it. So I would definitely consider eating disorder. I don't think she's pregnant. I doubt she has depression. I don't know for sure though, and I would definitely say she's anxiety. I worry about her stress levels and all that kind of stuff with so many big changes going on at one time. What treatment would you recommend if your diagnosis thought is correct? I would want to send her to her therapist. This is something that's out of my pay grade, I guess. I understand the signs and symptoms of different mental disorders and that kind of stuff, but I'm not certified to do the therapy and the cognitive stuff that this athlete likely needs. So I would refer her either to try to see if we have like a school psychologist on call and refer her there, or if I have connections in the therapy world or something like that, or if I've had sent athletes before, I would send her there because I think that she needs professional help, professional therapy for an issue like this. And even if she doesn't, it doesn't hurt to go. Worst case scenario is all this stuff is just a phase that she's going through, and she goes to one therapy session, realizes it, and takes better care of herself and stuff like that. So worst case scenario is she has a therapy session and she realizes what she needs to do. Do you have the duty to tell the coach, parent, etc.? This is a tough one. So talking specifically about the parent, a lot of it depends on the state. What the laws are for that because she's 17. If she's over 18 though, or if her birthday is soon, I don't have to tell I shouldn't tell the parents because she didn't want me to. As far as the coach, I don't think the athlete should be participating at this time. She's got a lot on her mind. She's not going to be able to focus at practice. My coach always said, if you can't focus at practice, don't be at practice because you're only going to make yourself worse. And especially in gymnastics, you might get hurt. You might hurt yourself more because she's already had the incidents where she fell off the beam and that kind of stuff. So I would tell the coach, hey, nothing too there's no injuries or anything like that, but this athlete has something going on that she just cannot focus on practice right now. So she just needs to relax a little bit. She needs to sit out for a couple of days just to get her mind straight. So this way she doesn't have to practice. She can get out of one of the things that's likely stressing her, she can avoid, which I think might help her out a little bit. And then that would also give her a little bit more time I would recommend her go to a Planned Parenthood or something like that, because at Planned Parenthood, you can go without your parents knowing. So I think that would be a great way to find out if she's pregnant. And I think that's a great first step.